think I can do these?
I
hope so.
And we'll
Right?
find out, baby.
Okay, so first of all, and if you're not used to lying on your stomach, these may seem a little difficult for you to start with, but just go at your own pace. And you may need, depending on how you tolerate it, you may need different levels of support when you're lying on your stomach. So some people can just lie on their stomach without any support underneath it and nothing under their legs and feel okay. Other people may want to have a pillow under their stomach or even two pillows under their stomach. That can take a little stress and strain off the back area, or you may need something under your lower legs or your ankles. So if you need to do that, that's okay for these exercises. Just modify it as you need to. So the first one I'm going to demonstrate is called a prone press or a pelvic press. Now, I'm not, some people may have heard of a pelvic tilt exercise. This is not a pelvic tilt. This is a press. I'm kind of trying to activate my core in this position and stabilize my back, because I'm going to want to do that when I do some of these other exercises. So this is kind of like the base of doing some of the other exercises in this position. And again, all these instructions and pictures are on the handouts. So I'm going to use my hands or my fingers as a little bit of feedback. So I have my fingers kind of between my belly button and my front hip bones here as a little bit of feedback. And what I'm doing, as you can see, there's not a whole lot of motion going on. You may not even think that I'm doing anything, but what I'm doing is I'm thinking of gently pressing into my fingers. And when I do that, I'm getting a contraction of some of my deeper abdominal muscles that blend around with my low back. So I'm getting like a core contraction. Now when I do this, I'm doing it right now, I can talk, I can breathe normally. I'm not doing it like this with my breath, which is a natural reaction, but you certainly want to go nice and easy and be able to talk and breathe.
So you're pushing?
I'm pushing very, very gently. But when I push in, and so when I'm starting to feel a little bit of a tensing in my fingers here by my abdominal muscles, and then I stop right there. And I just hold for about a 3-second count and relax. And then again, there's not a lot of motion going on. Doesn't seem like much, but if you do this, you'll feel it working. And again, this is just kind of the base for some of the other exercises, because this is helping to stabilize my back.
Are you pushing up or pushing down the stomach?
I'm pushing down a little bit, but I'm not getting a whole lot of motion. I'm not doing a pelvic tilt, and it's more of an isometric contraction of the muscles. So I'm not really going up and down, it's more drawing them in. If you want to think in this position that I'm almost drawing my belly button up towards my spine. So that's the type of motion it is.
And your
So
head's
you could really be doing that sitting up.
Yes, you can do that.
mean-
Yes, this is a type of exercise. We show it to patients in all kinds of positions, certainly, and certainly sitting or standing, walking. You can do it, and it's a more functional exercise. But for this particular presentation, doing them in this position is important. But yes, you can do this in various positions.
And when you're laying down, your head needs to be up, right? Or
Well,
you
I'm just doing.
Yeah.
I have my head up just so I can
Right.
talk
Right.
right now.
Can you do it down?
Yeah, no,
Yeah.
you would normally you'd want to have your head
Right,
rested here.
yeah, that's what I thought.
You might want have a pillow or a
Right.
rolled up towel. I'm just doing this just so I can talk to everybody here. But yes, that's so have my head and my neck relaxed. And again, if somebody has some postural issues, you may get in this position and you're so tight, especially up in your thoracic spine, that you can't get down here. So you may need to have maybe some pillows under your chest here to give you a little bit of support. So again, just modify your position as you need to, just so you're comfortable.
So the pushing is with your body, not with your hands. Your hands,
Right, my hands are just here as a feedback
okay.
mechanism.
But you're
Make
pushing
sure
with your
that I'm
body.
doing it correctly. Somebody might come up here that doesn't mind being on camera.
Hmm?
Somebody that doesn't mind being on camera want to come up here?
To do what?
Just to feel my back.
Put you back.
Okay, so you can put your hands here.
Both hands?
Just nice and easy.
Yeah.
Okay, so
Oh, yeah.
feel just
Yeah.
a little bit there.
It's gentle. It doesn't move a lot. There- yeah. But it
So
does move
you
up
can
and
feel
down,
a
yeah.
little bit of
Yeah.
movement there, but a little bit of contraction. So actually, my back muscles also contract on this. It's not just my abdominal muscles; it's getting my back muscles. So that's why it's a good little core maneuver. So from there, so now I'm just moving my hands because I know how to do this little press maneuver. So I'm pressing here to stabilize my spine, and I'm going to do a leg lift. So I'm keeping my knees, I'm not bending my knee, I'm not rolling over like this. I'm trying to keep my trunk stable and lift one leg up. You can either do all the repetitions on one side and then switch, or you can alternate. It does not matter. So the motion is occurring at my hip joint. So I'm extending the hip, the knee stays straight, but this not only requires strength of my hip, but also my back. And I'm doing that little press maneuver too that we started with.
And your feet stay flexed with your toes pointing the floor, right?
Whatever
Sort of.
feels comfortable for you.
Okay, just not pointing out.
Yeah, the main things on this is you're not lifting way up.
Right.
I'm not bending my knee,
Right.
and I'm not kind of twisting back and forth here. And I'm not in a hurry. I'm not
Right.
going very fast. Going nice and slow and in control.
Yeah, got some of those.
And on all these, I have written on there that you can do 10 repetitions, but if you start with 2 or 3 or 5, whatever level you are at, that is fine. You can gradually work up to more repetitions. Any questions about that exercise?
The more the better?
Well, the more the better. Well, as we know from the one study, that just doing 10 reps
Right.
for once a day for 5 days for 2 years was effective. Not necessarily the more the better. Just like anything else, you can certainly overdo exercise, especially if you haven't been exercising, you've never done any exercises like this before, and you start doing them. I would just certainly start with no more than 10 repetitions of these in just one set. Even if you feel like, gee, this is no problem and I can do this all day, 24, 48 hours, you may be, gee, I think I overdid it a little bit, or wow, that was harder than what I thought. Again, these may not seem like they're too stressful, and you're not using any weights right now, you're not using any machines, but these exercises can be a little deceptive and a little tricky, and they can actually make you work pretty hard. So ultimately, at the most on any of these exercises, I would recommend upwards of 3 sets, 8 to 12 repetitions. Don't necessarily have to do any more than that.
Each side.
So is this
Each side.
strengthening your entire spine? It looks like it would be more the lower back.
And this is more, it's a hip extension exercise, so I'm working the muscles, my glutes especially, that extend my hip.
Can you do
But-
that with a replacement? If you had a hip replacement?
Well, it depends on where what type of approach was used. If you had a hip replacement and they used an anterior lateral approach, one of the contraindications or precautions is hip extension. So you'd want to certainly be careful with that, or I don't know how long ago it was, or you double check with certainly your surgeon at this point and see. Usually those precautions are certainly early on, but as it goes along, easy. But what you need to know or remember is, let's just say the left side here, my gluteal muscles on my left side blend in with muscles on my back on the right side, and vice versa. The muscles on the back on the left side blend with the gluteal muscles on the right side, so it forms like an X pattern from the back down to the hip area. So doing this type of exercise is not only getting the hip area, but it's getting back muscles on the other side too.
What if you have 3 big old screws in your hip
3 big old screws in your hip
from a fracture?
or a fracture. Again, I would be cautious with this. Doesn't mean that you can't do that. You may, even if you just do a small motion like I'm doing now, you don't necessarily have to lift way up here. You could just do very small motion. And again, if you have any other issues, orthopedic issues going on, be cautious with these, or check with your physician or your surgeon and get clearance for something like that. If you're not sure. I don't want to tell you to do it. It'd be different if you were my patient and I kind of knew a little bit more.